And we continue to track the vaccine rollout, and tonight there are more questions than answers about who is in the next phase to get the vaccine. An advisory panel met today to try to hammer out phase 1B, but they did not come to an agreement. That same group needs to give guidance on how to distribute the vaccine. Channel 3 Eyewitness News reporter Mike Savino joins us live from the digital desk. And Mike, did we get any clarity on distribution?
Fortunately, no, Aaron, and that's because the rollout needs to make sure that those doses are getting to the people so that they can actually get vaccinated. And of course, that means deciding who is in this next phase first.
We will transition quickly between phases when we start to see that the demand for the current phase is not equaling the supply.
The Department of Public Health is preparing for the next phase of the vaccine rollout, confident phase 1A will be largely complete sometime this month. But the agency is still waiting on guidance from a key advisory board. Today, the panel failed to finalize plans for who should be in phase 1B. First responders, teachers and school staff, and manufacturing and food workers are in, as is anyone over the age of 75. The advisory group also seems supportive of adding people in conjugate settings, including prisons, group homes, and inpatient care.
These are the people that are dying in Connecticut. So shame on us if we don't consider this in that balancing act.
But some on the panel said people of color are being overlooked, despite being more affected by the coronavirus. Some members wanted to add anyone with an underlying health risk to phase 1B, but others say the goal is to vaccinate anyone at risk of dying or spreading the virus.
This is a balancing act between protecting those that are most vulnerable and preventing the disease spread.
Without a decision on who's in phase 1B, the DPH is also waiting on guidance on how to distribute the vaccine. The agency pointing out some groups of people will have a hard time getting to a hospital or a pharmacy.
If we don't make vaccine accessible, it will be for naught.
The state is confident it has found effective strategies with testing that can be used for vaccines.
We've been really able to expand testing access, primarily addressing our high-risk and vulnerable communities.
Now, the governor was hoping for final plans by Thursday. The panel did not set a date for its next meeting because it first wants more data from the DPH, but members do realize that time is of the essence with that first phase coming to an end soon. Live from the digital desk, Mike Savino, Channel 3 Eyewitness News.